Hi, I'm Dr. Gabby Cora and welcome to my Wellness Doctor and Coach certification program exclusively for physicians. Now, why physicians? Well, many of us have really joined our profession to be not only the doctors who help in pathology, but also help our patients achieve their maximum health and wellness, their ultimate health and wellness. And yet, with the current state of healthcare, many of us cannot do this, but at the same time, we've seen many other people come into the healthcare arena and provide for some of the services that we should be providing. So if you feel that you're one of the doctors who really went into medicine to help out, not only fix the problems, but also heal people on a very high level, thank you for joining me. Now, what's particular about this Wellness Doctor and Coach certification program for physicians? Well, first of all, it's given from physicians to physicians. So there's something very unique about that particular part of this program per se. The second one is that we're going to see not only things about coaching per se, but I'm going to help you build your whole empire around health and coaching and practicing medicine the way that you were meant to practice. So this will include tons around speaking engagement, corporate health and wellness programs, consulting programs, coaching per se, of course, networking, social media, and many other things that you would only be able to learn by doing an MBA as I've done, plus joining many other separate programs. This program brings everything together. The third point that is very important here to share is that you're going to be part of a very unique and elite group of physicians way ahead of your curve. So as a pioneer in this area, I invite you to join me in the Wellness Doctor and Coach certification program. Are you a brand or a celebrity? Hi, I'm Dr. Gabby Cora, and this is the mini video series for the Wellness Doctor and Coach certification program. I thought this was a very interesting topic, particularly because I'm asked about this all the time, not only by physician colleagues, but by other people who are very interested in being able to market their services as well. So most people are very interested in becoming a brand, and that is a great strategy, particularly if you're trying to establish yourself. Now, whenever we talk about branding, we don't only talk about branding when we refer to people, branding their expertise and their services. We also have branded hospitals, for example, and even hospitals that have become a celebrity. Now, what are celebrity hospitals? Some of these celebrity hospitals are very well known by all of us. For example, Mayo Clinic, Cleveland Clinic, and/or Johns Hopkins. We usually think about these as state-of-the-art, very, top-notch places whenever we refer to them. So although they may have branded much of their expertise, these are celebrity hospitals too. Now, what can we do as people, as practitioners, to become that celebrity, to start being an expert, but then go on our path to being a celebrity? And why is this so important? So let me start with the first point, which is there's a timeline. It's not like we have to think about either being a brand or a celebrity. It's all about the timing. And what I want to also share with you is that this does not only relate to television or the media in general. Think about this. For example, in my case, I came in to help within a company when they were having a transition of their CEO as a leadership consultant. So when I first came in, I came in because I was seen as an expert in stress management, crisis management, and everything that related to leadership per se. So that was my expertise. That was the branding that got me inside of that company. Now, as soon as we started working together and we got some results going and people liked working with me and they started to trust me, they started to also ask me to help them in other areas. And this has not only happened to me within this company where I ended up actually addressing and creating some programs for them with their call center or even with their health and wellness program, but it's happened to me repeatedly whenever I've worked with different clients. And this is one of the reasons why I decided to create the Wellness Doctor and Coach certification program, so that I can share some of those experience and break down the process, the method that I used to be able to be inside of a place and then start helping people in other areas as well. So the first part when I first came into this company was definitely branding. I came in because of that expertise. But eventually, as I started working and helping out in other areas, it was basically built upon the trust that people had on me and the realization that I could also be of help to them. So within that company, I became a celebrity where everybody knew me, where everybody knew that I could also help them in anything that had to do with transitions, for example, or new beginnings or new programs. And that's a bit of how I made myself a great collaborator to their initiatives. So this is one very important factor, timeline. So it's not about being a brand or being a celebrity, it's more of an issue around timing. The second point that is very important in the branding versus celebrity is I've noticed that the people who've been the most successful have really worked on their area of expertise, their branding first. In my case, what was extremely valuable to me was to position myself as an expert in mood and anxiety disorders when I was a researcher at the National Institutes of Health. Why was this so important? Well, I was there for several years, and the results of being there not only included conducting research and collaborating in research in areas of mood and anxiety, but this also ended up in peer-reviewed publications, grants directly through the federal, the federal government and the NIH, and it also allowed me to come in as a speaker at National Association meetings and or other annual meetings to help other colleagues with the information of what we had found. Now, the other interesting thing is, as a psychiatrist, most people think that we do everything around maybe pharmacology and around therapy, but the beauty of having been there as well allowed me to also collaborate in projects that had to do with neuroimaging, genetics, and even transcranial magnetic stimulation. So it's very interesting to see what it is that we may have as a foundation and use that as our expertise or branding. Having been at the NIH made it a very easy transition for me to later be at one of the pharmaceutical companies within Pfizer Pharmaceuticals, where I continue to help with grants, but now more with relationship building with other colleagues at different places, at different academic institutions across the United States. So from that expertise, from that branding, I was also able to do some other things. I think I always say that the opportunity to have been at Pfizer gave me like a practical MBA. And I think that from that branding, from that marketing perspective, it really allowed me to learn tons about how to package and how to put everything together. So that's the second point that is very important about trying to brand with that expertise. Now, interestingly, once you're seen as an expert in an area, it may be easier for people to hire you, to bring you into other projects that may not be directly related to that, but they already know that you can do it. So for example, one of the things that I did with Pfizer Pharmaceuticals after I left Pfizer included being a consultant to them in a marketing program of something they wanted to do with the Hispanic community, where I trained the trainers. I trained other physicians, not only in mental health issues, but in cardiovascular issues as well, and in media training. So once you have that trust again, that's when you can leap into being able to do some other things in which you're regarded more of a celebrity. The third point, which is probably the foundation of being able to leap from being a brand to being a celebrity, is trust. While you build trust by being a brand, you really build that consistency, that reliability, that being there and having a constant presence there as well. What happens in celebrity is the trust is already inherent there. So when you become a celebrity, people are already trusting you. You don't need to build any trust. You needed to do that while you were trying to brand. If you don't have that trust while you brand, you're not going to have any celebrity going there. So it's very important for you to try to figure out, what is it? Where are you now? or your brand, or you're a celebrity, or are you just getting started? Where are you at in this transition? And have fun along the way. We're going to go a lot deeper into branding and becoming a celebrity during the Wellness Doctor and Coach certification program starting in July. So if you're interested in signing up, visit wellnessdoctorandcoach.com. Again, wellnessdoctorandcoach.com. Thank you. I hope you enjoyed the sneak preview of the Wellness Doctor and Coach certification program, and I look forward to seeing you in July. Now, how can you sign up? Very simple, by filling out a form that you need to request directly to me on my private email. What is my private email? It's gcl@drgabbycora.com. So write me a private email at gcl@drgabbycora.com. Request the form to sign up, and you'll be one of a group of 12 people coming in and joining me on the Wellness Doctor and Coach certification program. Thank you so much for watching. I look forward to seeing you in Miami in July.